Okay. As I've seen track proceedings over the past several years, we have three big types of audiences. One is the social activists, and I guess that's kind of where most of us lie. One of us, I call them economists or scientists. They just want facts, they want numbers, not necessarily overly interested in the social good, but that's their main focus. And the third one is the health professionals. You know, when you ask them, imagine a world where you didn't have to fill out so many so many forms, and they all smile. No one's exclusively one, but everyone's predominantly one. What I'm asking people is to make a mental note of those three, the activists, economists, and health professionals, and think about when you speak to people, use something that's outside your predominant. So if you're, say, an economist, start talking like a health professional. The next thing I wanted to talk about is there are two types of Calcare support right now. One is organisational and one is personal. So that's interchangeable. So for many of us, which belong to many various organisations, we get 2 bites of the cherry at the very, very least. The next one is basically a case study of a communication activity that I did. So I was at an Oscar Writers Party. This is the Writers Guild Foundation, which is basically the non-profit arm of the Writers Guild of America, which organises events and classes. So I went up to the executive director and I said, hey, as a side gig, this is what I'm working on Calcare at the moment, and I really want to discuss. I was pushing for a logo, a WG Foundation logo. The executive director stopped me right there and said, look, all our policies tend to be, our healthcare benefits are determined by the union. And I said, fine. So then I started name dropping. There are a couple of other organisations which are approaching the Writers Guild, and I dropped names of people that I knew. So she smiled and she established a connection there. And I said, you're in the same building. I want you to go over to them and discuss what they're doing. But very, very basically, I'm giving her a push and say, get the Writers Guild to pull their finger out and get busy. So what I'm doing is leveraging my position. And then I went back to her and said, okay, but the Writers Guild Foundation has got 6 staff members. You can do support on your own.
Hey,
so
Jim.
Hey? Okay, so what I want you to do is basically act as leverage. She said, send me some information about Calcare. So I sent her a link to the page, what it is, and also how to sign up their support on the info at Medicare for All. So basically, don't give them too much to look around in unless they want to, but give them direct clicks. That role is basically called the connector, where you speak to many people at the same time. So the expression I was taught is extend your reach, not your grasp. One thing also is that I noticed that many of us belong to political groups and various community activist groups. That's fantastic. That's how our low-hanging fruit. So one morning, I belonged to a Tai Chi group. I went out there with about 20 flyers, gave a little presentation, gave them a flyer each and said, this is what I want you to do, call your legislator. There was one kind of objection because they weren't very happy about undocumented people. And I said, okay, that's fine. We can talk about that later. They actually aren't as much of a burden as you might think. They do pay taxes, and the amount of healthcare dollars that are spent on them is actually extremely small. So look at other groups, things like community gardens, community halls, religious spaces, sporting groups. I live in Hollywood, so I looked up, supportive housing, Hollywood Tenants Association, and just sent them a nice big email saying, this is what I do, would like your support. I've often been told, do not ask me for money or I'll stop you right there. And I said, this is all I want you to do. Either put your logo up on the website or sign up. So also I deal a lot with publicists in the entertainment industry. And as Erica may testify, I've been trying to pull in these big whales, the Jane Fondas, the Susan Sarandons, who are big activists, but they're not going to say yes to us. Otherwise, they're going to, everyone's going to be pushing them. And I said, but I don't know what conversations they're having outside of me. So I did another big email run with the publicist, and they said, look, the company is not really supportive because they class what you're doing as political. And I said, fine, but you have colleagues. I want you to reach out to your networks, your personal networks, and just get them to sign up for the Medicare for All, to pledge their support. So I got a few bites out of those. We are on a time crunch, so obviously go for your low-hanging fruit first. But really, I'm getting you asked to think a little bit outside the box. When you're speaking to people, it's also helpful if you ask them, what groups do you belong to? If you've got some time, I can give a presentation. I can give you some flyers. But at the very minimum, just get them to sign up. And that's going to keep the conversation going. Because even if you don't get a response initially, you're at the very minimum the first contact they have. You could be the 29th contact they have. So just keep chugging along. And that's my 10-minute crash course in effective communication techniques. Big key legislative dates. So apparently, you might want to sit down for this. A very hardworking legislature is on recess now until the 1st of the month because they work so hard and so efficiently. But the next key date coming up is the 26th of April. So basically, that's the deadline where all fiscal bills must leave committee. In our case, it's the Assembly Health Committee. And that's why it's important for us to keep pummeling them. If you don't have much phone call time, if you've got phone call time, do call them. You will get someone on the line, typically a legislative director. Unlikely you'll get the actual legislator. Apparently they're in meetings a lot. That's why they need their recess right now. Also use their online form if you can't get to a phone. And it means you can do that stuff, late at night. One, it doesn't matter if you contact them multiple times. They will listen to you. They may not respond, but keep doing that. The next big legislative date is May 17, which is appropriations. And by the 24th of May, everything has to be voted on and clear the Assembly floor. Then we start thinking about the Senate over summertime. Erica, so let's talk a little bit about calling the Healthcare Committee. If you want to make a quick comment.
Well, hello, everybody. Welcome. Welcome to this Healthcare for Us general meeting. I see almost all familiar faces and a couple of new ones. So glad you all are here. Yeah, so we just came off of doing some Calcare house parties. And I know most of you have been really involved in the activism around this bill. And as James said, the next step is the Healthcare Committee. So if we don't pass Healthcare Committee, we don't continue on. So I am going to drop in chat in a minute. I think everybody on here already is down with this information, but just in case, I'm including a link. If you don't know who your assembly representative is, I've put a link where you can find them. So we're asking everybody to know your representative, and we're asking everybody to call your representative and tell them you support AB 2200 and you want them to support AB 2200. And then I've also included in there the Health Committee Chair, Assemblymember Bonta, and the Assembly Majority Leader, Aguiar Curry. So these are key positions that we're asking everybody to make phone calls. So to the committee chair, to the majority leader, and to your assembly member. Just so you know, Bonta, the next step after the health committee is appropriations, and Bonta also serves on appropriations. So you're getting two committees with one with Bonta. After you call your committee chair, after you call the committee chair and the majority leader, we're asking that you call your assembly representative once a week. Why not? Half the time they don't even ask your name, they just ask your zip code. And when you call the Bonta's office or Aguiar Curry's, if they ask, for your zip code and, state you're not a constituent, you can reply, I am a constituent of California, and this is the chair of the health committee, and this is the majority leader, and they represent me. I am a constituent. So give it right back to them. Really encourage you to just copy this information down and then share it as far and wide as you can. Definitely find that, texting or calling, having these personal asks of your friends, like Alex, if you texted your friend Erin and said, hey, Erin, can you make these phone calls today? Right? So one-on-one personal is the best way to do it, but you can always put it on social media as well. So I think that's it for my part. I want to acknowledge James, who is our recording secretary, for stepping up to lead this general meeting. Our co-chair Gina is not with us tonight because she's doing other important work. And we just really want to kind of rotate our board members, and James was the first one to step up. So thank you so much, James. Dennis, did you have a question for me or no? Okay. So I think that's all my part is, and thank you.
Okay. Erica, please don't say Gina is not with us tonight. That sounds morbid, but I'm glad you clarified after that. And also acknowledge to everyone who's been manically doing all those Zoom calls, not just a quick email or anything like that that I have time for, but you schedule Zoom calls. Much appreciated. Item number 5 is Party Like It's 1999, House Party Weekend. I want to see a show of hands who hosted a party over the weekend and who attended. Okay, you'll all notice that both my hands are down. I've been grounded. I've been there in spirit, whatever that means. What I'd like to do now is just, if anyone wants to raise their hands, I'm curious to know the format of the event, where it was it a house, was it a park, how long it lasted for, how many attendees were there, and basically what you did. Does anybody want to start? And where do I find the hand list? Okay, I can't actually see the, who's got their hands raised?
Dennis has his hand raised.
All right. Okay, Dennis, and followed by Paul then. Talk about your big party.
And thank you, Martha, for your comment in the chat. Yeah, our event was very well attended. I would say there were just over 20 people who attended. A very lively crowd. Got to say that CNA did an outstanding job coaching me, and the actual, I call myself the co-host. The actual host was Shahrazad Shishigar of both me and her are of the San Gabriel Valley Progressives. not that it was a Sangamo Valley Progressives event, but we did get a lot of people from the area to attend. Actually, some people from outside of the area too, which was great. Because of course we didn't want just people hosting canvases in our area, but at places where there's lots of foot traffic all over LA County. I think 5 people stepped up to host canvases, and then a whole bunch of other people stepped up to be a part of those canvases. The format was pretty straightforward. I mean, again, CNA laid it out pretty well. It was easy to follow. Everybody understood the content. Few people did show up who didn't realize it was going to be an organizing event for canvases. I think they were there because they had more questions. We answered the questions the best we could. But yeah, it was a great time. I loved it. Charizard loved it, and everybody had it was fantastic to see all the people who showed up. I think there were some other things you wanted me to share in there, but I'm not forgetting.
It was really key takeaways. I know they were fairly well structured, but anything that was more effective in the weather and the party least effective, what does Party 2.0 look like?
Good question. Again, CNA did a really outstanding job setting this up. There might have been a reason why they didn't advertise this more as a campaign, you're coming to this event to, either host a campaign or host a canvassing event or be a part of one. That there's possibly they didn't make a big deal about that because they didn't want to scare people away, which is also a great idea. I can't really think of anything at the moment that could be improved. Again, for our part, I thought our event went very well. And we had 5 canvassing events that came out of it.
5 events, that's pretty awesome. Woo, woo, woo. Paul Newman, can you top that? I challenge you. Are we on mute?
I'm on mute. If you guys want to pin me, that'd be great. Or if you don't, it's cool either way. Anyway, it was great. We started off with a lot of goodies, food, croissants, taquitos. They're called egg. I forgot. They're like cupcakes, but they're egg cupcakes with veggies in them. We had all kinds of good food, drink. It was just really nice. Maureen came over to help out, and she was just absolutely amazing. So wave your hand, Maureen, so we know who you are. So anyway, then we started. I mean, Maureen, you can chime in too with this because you were there, and also James Fortman was there too. It was a lot of fun. That's the first thing. So what we did was we had a round table, and there's a woman named Isabel Story who I think is running against Zubar. And no, that's not true. Okay, I take that back. I thought I heard something about it.
Isabel is a constituent of Zubar.
Okay, as am I. But anyway, we were talking about, had a little round table before we started the video, if I'm correct. And we all discussed the problems with the healthcare system, how it's broken. Maureen did a talk about what Calcare would do. It was just, to sum up everything quickly, it was just amazing. Maureen was just stellar. I invited a friend of mine, his name is Zane Tatum, and Zane is in the construction industry. And part of the agenda for these little parties is to recruit people to canvass, whether they want to table, text, or make telephone calls, knock on doors. But also the other part was to invite people who have businesses who are interested in this. And Zane, who's in construction, wants to get some people he knows who are contractors together, because this is Calcare is a huge asset for people who are in construction, because people are getting injured. They have key carpenters and they're hard to find. So in that sense, it was a huge success. And Zane's come on board with us, which is really great. And so anyway, then we watched the video, and Carmen Comsey spoke about the bill and everything, which was really cool. That was just a half an hour. And then afterwards, we took little short videos and group shots and everything. And all in all, it was a lot of fun. So that's my little story. If you have anything to
I
add,
would like
Maureen?
to add one thing. First of all, thanks
Sure.
for all the praise, but I think, anyway, thank you. But we were really fortunate. We had a UCLA professor of healthcare
Oh,
policy
yes.
at the UCLA Public Health School. She's an assistant professor, Naomi Zuede, and she was fantastic. She shared a lot. She answered people's questions. That was really helpful. We also had a respiratory therapist who ran her own business, but insurance industry put her out of business. She had to sell her business off because of insurance. So that was really interesting, Diana Goth. And we did get three people to volunteer to do the house parties. And one is James Forthman, who's on this call. Hi, James, wave to everybody. So James volunteered, and also Isabel Story, and also Zane Tatum. So they are each going to continue on with another house party.
Anyone else in the group? I noticed a few of you attended. Did you want to add some comments, how you felt about things that made you very excited about the day? Yay. Oh, Joe?
Yeah. You gotta say that I came over to the meeting at Paul's house, and it was like something about, getting people together and, having more, any as an open house thing, and, and giving my thing about, getting the whole bill in, which, which I did write to my reps about, the favor of the bill, and saying that more people should be aware of this. And it should just be to the general public, not just for the select few.
Okay. Go, Carol.
My name is Joe Donahue. I'm a registered nurse, retired in 2016. I live in Salinas, California. That's where we held the house party at the United Farm Workers building. They were also having a consular meeting in their large hall. And I thought, oh, that's going to be noisy and interrupt us. It was just the opposite. We got invited to go over and make a presentation in front of their group as well. So 2 for the price of 1. We had probably 15 or so, I'm not sure, people there. 3 of them agreed to do canvassing. It was a mostly Spanish-speaking group. We had 4 co-hosts. 2 of us were RNs. Many of us were bilingual. So we decided we had an after meeting to discuss what went well and what we could do better next time. Because everything took longer to repeat in the opposite language, we decided maybe we'll try to get 2 rooms and have 2 different presentations, one in Spanish and one in English, to make it move faster. All in all, I think it was tremendous. That was Saturday. On Sunday, I looked on the map just to see what else is happening around. Guess what? There's one happening over in Carmel by a guy who's never done it before. So we connected. I offered to back him up. He had 10 people. His wife made a full-on St. Patty's Day dinner. The crowd was good. We had a good discussion. And one person did agree to do canvassing after that. So it was productive. Yeah. There were only 2 people that were really ready to support Calcare. The others had many questions. So we gave much information. And that was that.
Spanish and English. You are awesome, sir.
I'm not bilingual, but many of us in the group were. We're a team.
Don't argue with me, sir. Take the credit.
Joe, I want to let you know, I direct messaged you. You had a question for me earlier. So if you check, I noticed you haven't looked at it. So I direct message you the answer to your question. Okay, thank you.
I just want to share that I went to a house party in Glendale, and people were talking about where to canvas. And the place that people liked a lot were metro stops. And people talked about, you know, how sometimes you can look and see like when the next bus is coming or the next train. And so, you know, you have time to talk to people and they're not going to worry about missing, you know, their destination. And then, you know, one person was saying that, you know, she likes to see, you know, if somebody doesn't make eye contact with her, if they feel like they're just, if she can tell they're not interested, she just moves on to the next person. And I think that's a good strategy when you've got lots of people that you are available to talk to. So yeah, it was good. And you know, I think there's a lot of good energy out there and here tonight.
Indeed. Does anyone want to talk about the party last night? Because the weekend wasn't big enough, we had to go into Monday. Any takers? So, any unusual places?
James, there is. Timothy raised his hand.
Okay. Sorry, sir, I'm just not seeing you in the raised hands, but do speak.
Yeah, no problem. Hey, yeah, so I went to the one last night that Erica and Gina hosted, and you know, they're pros. It was at the most beautiful, oh my gosh, my son just popped in on my wife's screen. Sorry, I'm distracted. It was great. There was a lot of familiar faces there, a couple of new folks. It was at the most beautiful view of Los Angeles that I've ever been at before in my life. And super informative. Ash Kalra zoomed in live, which was fantastic. And he's so compelling. Oh my gosh, my sons, what great looking kids.
I know, we're all distracted, we're waiting. Hi,
know what?
boys. Hi,
You know
boys.
what, Tim? I'm visualizing them both with mustaches right now.
Yeah, no, I mean, it was a lot of familiar faces, a few new folks. We talked a lot about trying to work on unions, trying to see if we could get a couple more unions to sign on and write resolutions, etc. That's something I'm going to be spending some time working on with my union, and yeah, it's great.
Anybody?
Tim, I just want to ask you, was there anything outstanding that Cara said, maybe that you hadn't heard that you think everybody should hear? And if not, that's okay too. Besides, he was
That Ash commented?
Yeah. Besides the fact that he's a badass, but yeah.
He is a badass. He said a lot of great stuff. I mean, the thing that stuck with me, but mainly I think because it was reinforced later in the meeting, was the, you know, what we legislate, we don't have to negotiate. As far as talking to unions, you know, I know just I'm a SAG member and just coming out of this last year where we were on strike for over half the year. And I know I really didn't make much progress, you know. If healthcare wasn't something that the union had to negotiate about, then they'd actually be able to negotiate about like wages and working conditions and residual
AI,
all the stuff that is actually you know, like devastating actors of my level right now. So yeah, he said what we legislate, we don't have to negotiate. And if we could just remove unions' need to negotiate about healthcare because it was already provided for all their members, then unions would just be in such a better place to negotiate the things that they actually need. And that was, I think, the thing that stuck out most to me from last night.
Thanks
And
for sharing that, Tim.
SAG is one of those unions. Their healthcare eligibility is set at $26,000 a year. which is pretty much minimum wage, as Frank Drescher was saying. We are not peons. You will pay us accordingly, or we won't work. And don't threaten us. Do not push us, because you know we will. And they're looking at all the other unions now, saying we will march the line with them. So your choice. Did you want to say something, Paul?
Yes, I did. I just want to say that party also, I attended as well, and so did Maureen, and Scott was there. I got to tell you, that was the house was incredible, had an incredible view. The guy that hosted it was a civil rights lawyer, Jody Amore, and just it was like going into an art gallery. It was so cool. We had the Calcare bear, which Anthony Mercado's picture happens to have it in his picture. But also Ash Kalra said also made it clear that when people ask you, is Calcare, how are you going to pay for it? He said what it is it's a policy bill. And in order to find out how we're going to pay for it, we have to get a waiver from the federal government, which grants everybody anything, all the money that would normally go to Medicare, Medicaid, the ACA, Affordable Health Care Act would go instead to the state, and the difference would be made up in a progressive tax, which is really important to tell people because they don't know, and how it's going to be financed, and that's how. But you have to have the policy first in order to get the waiver, so he made that very clear too. So that, and plus he's formulating it and having doctors committees, who will decide on the claims, whether they're, important claims and need to be honored. So that was another thing that I got out of Ash speaking.
Indeed. Do we have any other comments about the house parties? I'm just trying to scroll through. Sing out. Otherwise, I cannot see you. So if you want to jump to the ledge visits and other actions. So Eric has already said, call your the health committee and also your own legislators. You also made up the policy. I think the point of this is a policy bill. And Carmen Comsty also said the same thing. This is important because it's actually a way to get your reps to sign on. And what I've told my rep is, this is a policy bill which cannot move forward until the financing is in place. When all these single payer systems were set up in Europe after World War II, it was just a couple of pages, and then they went through the normal financing procedure through their parliaments, congresses, whatever the case may be. So don't think you can't get buyer's remorse, which is really important. Also, another thing I say is that the nurses have actually thought very carefully and very comprehensively about financing mechanisms. So it's not just some hippy-dippy liberal policy we made up and we'll let someone else worry about mum and dad how they're going to pay for it. They actually are quite impressed and make the point that all your premiums are all going to go. The metaphor I've used in the past is, sure, we're going to ask you to put another rock in your backpack, but we're taking out a boulder. Which would you prefer to carry? And when they see that, and I said, yes, there will be, even with all the cost efficiencies and all the waivers, there will be a small shortfall, which will be financed through progressive tax. But when anyone sees these massive crushing taxes, which will make you want to move to Texas, they're pretty much lying. Another tactic I've used is maybe effective, maybe not. I tell people the November elections are closer than you think. Legislators know exactly what you're saying there. Say we're a well-organised machine. I think deep down, I think it's fear that's holding you back. This is your chance to make history. Yes, there probably will be hiccups at the start, like with any new system, but do not do not take the bait. Insurance companies know they're hanging by a thread, but I don't see why we need to pay for their bottom line. Did anyone want to say something? Because we're kind of running a little bit early, which is kind of awesome.
James?
Please.
I'd like to ask people who have looked at the bill, what they like most about it, what appeals to them, what about Calcare appeals to them personally, like what moves them. So I'd like to hear from some people, you know, what they think about the bill, even if they haven't read the new one, but they've read, you know, Calcare, maybe just read the facts and the talking points, whatever. I would like to know what moves them the most and what they care about.
I saw Joe raise his hand, and then I
Mhm.
see Tomisa's hand. So Joe, did you want to go, and then we'll go to Tomisa?
You have better eyes than I do, Erica. Thank you.
Everybody's in. My nephew recently closed down the family business and applied for something for health coverage in the interim before he was hired someplace else. He had to sign up with new doctors and understand that system. Then he has an employer. Now he's got some health coverage through the employer. That's a different system, a different set of he's changed 3 times in the course of a couple of months. All of that. That's crazy. We have such a convoluted, mishmash, fractured healthcare market. Too many of people focused on the income rather than patients. That's enough.
Thank you, Joe. And am I pronouncing it right? Is it Tomisa?
Yes, Tanisa. Hi, I'm not really ready for prime time. I'm on oxygen, and I'm part of the rare disease community. I have a disease, scleroderma, that's so rare that patients have to go to specialized centers to get care. And my husband has our health insurance through his employer, the County of Sacramento, and they offer only HMO care. So I've had this long struggle, and I'm still fighting for appropriate care, because our current system, like for HMOs, they have to give you care within the community, and community providers don't know about my rare disease. So that's a real big hurdle to overcome, because community resources differ. And we live about, 100 miles from the nearest center that cares for my disease, my autoimmune disease. So this is, it's also an issue for women, because autoimmune diseases affect women 4 times as they do men. So I support Calcare. I know the nurses work very hard, and I'm learning a lot. Thank you very much.
Thank you,
Thank you for
Tomisa,
sharing.
for sharing that with us. And we're really glad you're here with us tonight. And we are all in this fight together. Thank you.
Okay. Anyone else want to share a story? Want to speak? Have any ideas? Effective talking points? How to get more people on board? Oh, you're on mute, Maureen.
Okay.
That's better. You know.
Yeah, there are so many things in the bill that I love. I think it is just a treasure trove of great solutions to the many, many problems. We have this very dysfunctional system that is designed to deny us care, to make money by denying us care, charging as much as possible, paying providers as little as possible, right? So many things. The issues, I think the senior issues are really important because finally we will have everything covered that we need. What the legislature did at the behest of the insurance industry was to remove everything that a senior needs, like eyes, ears, teeth. I have friends with the $9,000 dental bill that she can't afford to get her teeth fixed, and I see so many of us that have lost teeth. And that's really an outrage in the so-called wealthiest country in the world. So I also have a friend who's 2 teachers. Her husband at 76 had a brain aneurysm and is in a nursing care facility, and they're going to lose their home because that's not covered under Medicare either. And that's something 70% of us over the age of 65 are going to need that kind of care, whether temporary or maybe even for decades. And the average cost, if it's just like a facility where you're not actually getting medical, but you're getting just the like activities of daily living, that's $80,000 a year. It's $120,000 average if you need nursing care. And if you have someone come in your home, it's about $60,000 a year. So who can afford that? So what happens is people put their homes in reverse mortgage. And I tell the young people, this isn't just about old people, because your parents worked all their lives to put their money into a home, maybe into, savings, into stocks, into whatever, to save their money to give to their children so that they would inherit something, right? And this deprives the family of really sharing family wealth. It's not even really wealth. I mean, it's just maybe a small home that you can have your kids, that give to your kids. And I was once in a group of women. They were primarily immigrant community, Asian, primarily Chinese American, and they were foregoing even getting care because they were afraid to lose their home. Even if you're healthy and you're not in a nursing facility, you can lose your home if you are on Medi-Cal and you need a lot of care. There's something called the state recovery that after you die, the government or the banks take your home to pay for the care that you got under Medi-Cal. So Medi-Cal isn't exactly free. Your family's going to pay for it after you're gone. So these are really hideous, horrible, inhumane things that do not happen in countries with single payer systems. The idea of medical debt. We have 100 million people in medical debt. We have people not getting the medicine they need, people skimping on their food, people that are now living in their cars because they got sick. And what kind of a country does that to their people? And the legislators are saying to us, oh, but the cost. My answer is, if we are the 4th or 5th wealthiest economy in the world, the state of California, where is that money? Why is it countries with 1/10 of our wealth, 1/50th of our wealth are affording healthcare for all of their people and everything they need, not skimping like our country does with us? So the question is, for these legislators, that's really really an outrageous and reprehensible thing to say, is that we are the 5th largest economy in the world and we cannot give our people healthcare. They say budget. A budget is a matter of priorities, and we want our health to be a priority in the state of California. Since we pay taxes, 70% of all healthcare costs in California are tax funded. We are paying for healthcare and we are not getting it. So whenever you speak to legislators or other people and they talk about cost, that's an absurdity, really. It's a matter of priorities. It's a matter of pushing numbers around on a piece of paper called the budget and deciding what matters, life or not. So we say life matters, and we want that to be a high priority. The money is there. It's just it's not distributed properly. It's not being spent on us.
And when people say cost, I just keep saying, yes, the cost of paying health insurance to deny us care. What are you going to do about that? And we are offering you an out to lower healthcare expenditure. So what you're saying is quite nonsensical. The numbers don't add up. You can't argue you're being a fiscal hawk because you're wasting dollars. You're basically a central heating salesman who demands that the windows are kept open during winter because you want to sell more heaters. That's all that's happening with health insurers. Stay away from them, and you know it. Anyone want to speak? One thing I wanted to ask, first thing, we do a lot of work. If you like what we do, our website is hc4us.org. Hit the donate button, throw some money on there, keep us going, greatly appreciated. We'll let you know. It's also tax deductible, so you can claim it on next year's taxes. What I wanted to ask before we start closing out is, have you been asked any really, really curly questions? I might start with one, and because Maureen, that's what you get for being such a brainiac, so it's your own fault. In the budget projections, it says savings somewhere between 20-30 million and nearly 300 million over a 10-year period, a billion rather. Someone said to me, that's like me asking you how much can you bench press, 100 pounds or 900 pounds? You're just making stuff up. The numbers are too broad. How can you possibly argue that there are any savings in there? All I could come up with, well, there'll be cost savings through bulk purchases and negotiation of drugs, medical equipment, devices. A lot of that administrative cost will go down from, the insurance industry argue it's 10 to 15%, but it could go up to like 20, 25 if you're including all those flashy ads. And also another thing I said is the big point of Calcare is that we're focusing on preventative care and early detection. There's no point in going to a hospital when you have stage 4 cancer when you could have been treated at stage 1. Is there anything else someone might add? We really have to start thinking, not so much about, I mean, we are right and we're all elevated people, but we need to do this with grace so that it's not a debate where there are winners and losers. We need to frame it in a way that people understand so they can say, okay, I hear you now. Thank you for explaining it to me. But Maureen, is there anything you wanted to add about that budget, the spectrum, the big number, the savings?
I mean, I'm not sure. Well, we really don't know the
Okay.
exact number because we don't have a policy bill enacted that tells us what we need to fund. So until the policy bill, because there will be amendments probably, until the policy bill is enacted by the legislature, we cannot begin to do a financial analysis that is in any way exact, right? We can get much more exact after that. Now, the last one that was done in California was SB 562, done by the Political Economy Research Institute at University of Massachusetts. And that's on our website, by the way. All this information's on our website.
Very funny, yeah.
And that they actually gave some scenarios, right? It could be this, could be that. And then they projected at least a minimum of $37 billion in savings. There have been, I believe, 22 studies in 30 years, the last 30 years of single payer systems that have been suggested, policy bills, some of them federal, most of them state, and even the Congressional Budget Office weighed in 2 or 3 times in this last few decades. And each and every one said that there would be savings, significant savings for
Yeah.
whether it was the state or the federal government in a
Yeah.
single payer system. Even the governor's commission, which just concluded that those were not single payer advocates at all. Those are pretty much unified finance advocates who want to keep the insurance industry in. But even they, their analysis said that there would be significant savings. And for the legislators that say, oh, but when, I believe it was 19 of the 22 studies that were done, that were analyzed in a meta-analysis, 19 of them said that the savings would occur in the very first year of implementation.
Yeah,
So,
yeah.
you
I
know,
like
the budget arguments really that I can see are relevant.
Yeah, I mean, the question really was, why is there such a broad figure? But you know what I'm going to say now? It's like going up to a builder and say, I want a quote for a mansion. And they say, well, what kind of mansion? How big is it going to be? What fittings do you want? I cannot give you a figure. I can give you the lowest I've done and the most expensive I've done, and it'll be wide ranging. Anyone else want to share any difficult questions they've had or maybe finding difficult to answer?
I see Alex had her hand raised. Alex, what did you want to share?
I was just going to, thank you, Erica. Hi, everyone. I was just going to weigh in on that last question. The thing that's been most impactful for me in these conversations is that, you know, the US spending 12,000 compared to 6,000 on average for high income countries. And what is that double cost getting us, or where is it going? And The Economist, and it's broadly reported on, that 45% of our healthcare expenditures are for insurance companies, middlemen, and big health. And so the other aspect that I share is, of our top 24, the most productive or best stocks to invest in, 8 of those 24 are insurance companies, including United Healthcare. And so really all of the costs that we would be saving initially, you just cut right off the top, stock buybacks, stock dividends, all of those profits. But that 45% number going to middlemen and health insurance companies, up from 25% in 2013, has really resonated with people as a clear, you can easily Google that in a 5-minute search, and that's been well received.
And the big point here is that there's no loss in quality of care. You're removing all the fat. Who's next? We've got 3 minutes to go.
I just want to point out that actually Alex produced a video that makes this point beautifully, starring Timothy and their beautiful children. So I'm going to encourage you all to go to our socials, HC4US_org, and find our middleman Instagram post. I have shared that. I shared it with my brother-in-law, who I've been talking to him about this stuff for years, and I don't know why he can't understand what I'm saying, but he hasn't. He watched that video and I saw a shift in him. So this middleman in the 45%, and what is a doctor, what is a nurse, what is a middleman, it's very effective. And then I see Dennis, you have your hand up.
Yeah, tough question I had a couple months ago on the funding of Calcare. So let's say the bills passed into law. Calcare is passed into law, and now we start petitioning the federal government for the waivers. And my question was, is there a situation in which we may be paying co-pays, deductibles, and premiums at the same time that we're also possibly paying taxes on the funding of the Calcare Trust Fund? I did not have a good answer, and I know there is a good answer. And it's also not a huge concern of mine, so I didn't look it up. But anybody have a good answer to that?
I'll tell you that the nurses say they're absolutely adamant about no out-of-pocket costs. So that's the answer, is that out-of-pocket costs are not in the plan.
Because a lot of people, if they know, or if they think they might have to pay something at the point of service, they won't even make the appointment. So this is to get people to keep their appointment, make appointments, keep their appointments, get the healthcare they need, and not worry about the financing.
And in fact, Dennis, it's in one of the 7 principles. It says free at the point of service. So there are no other expenses, if that makes sense, or does that?
And it is in the bill, and the bill, when enacted, will be law, so.
Yeah.
Sure, but I'm just talking about before Calcare can kick in, you have to have the money in the trust fund. And I know once we're past that, then of course we don't have to worry about copays, deductibles, and premiums anymore. I'm talking about before that, up to the point where we're building the trust fund. Is there a possibility that you could still be paying premiums, copays, and deductibles? I think that's what is. Go for it.
Yeah. So basically, you're talking about the interim period. The short answer is yes, because until the financial element is live, everything else remains intact. Did I see your hand up, Paul, or were you just stretching?
Sheila had her hand
saw
up.
Sheila's hand.
Oh,
Sheila had her hand up.
Jinx Marie.
please speak.
I was just going to say, I think the other thing that's important, and I understand now that the question was a little bit different, Dennis, but I think another thing that's important in regards to the fees at point of service is that we have so many folks who do not go to the doctor for preventative care because they can't afford it, right? And so if we don't have the point at service fee, then that means that people are going to go in for their routine preventative care, which will actually prevent additional problems and additional fees and additional, well, not fees for us, but additional problems for them later that then occurs exponential costs, right? When a person doesn't go in for their routine exam for cancer screening, right? Like when they don't go in for their well woman exam every year, right? Or now they've changed it. But when they don't go in for their annual exam, right? And then they actually have cervical cancer that's building in their body and they don't find out until 10 years later, that's an astronomical amount that they're then going to have to pay for cancer treatment. And that person's life is in danger and their entire family is destroyed by virtue of having to deal with this. So I think that's the other really important part about the point of service is it encourages people to get that routine preventative care that actually keeps all of our costs lower, right? And keeps all of us healthier.
You have so nailed it. It's like I need to go in for my eye test, whinge, complain, whatever. I hate. I don't want to go. But imagine if I get my eyes tested. It's you have the early signs of macular degeneration. I want to know that really early on. So yeah, I think we have Maureen's hand up.
Yeah, I wanted to share one other question because I hear it a lot from people and they say, well, once everyone is getting care, how will we ever have enough doctors? Because, you know, right now we don't have enough doctors and we wait so long. And one of the answers to that is first what Sheila said, and that is when you have preventative care, like clinic care in clinics, you won't end up with diabetic amputations and all the actual medical care that people will need if they can get public health care up front. And I was a nurse in the public health system here in Los Angeles in the clinic system. But the other thing about that is right now, physicians are spending about 20 hours a week of their own time, in addition to staff that they are paying to take care of insurance. Because the physician actually has to talk to some of these people when the care is denied, right? The insurance people. So there was a study done a few years ago by Kaiser Family Foundation, and they found that, okay, we have a little bit under 1 million physicians in this country. And they found that 846.4 million hours are spent on dealing with insurance bureaucracy by physicians. 846.4 million hours. Those are patient hours being stolen away from the public by the insurance industry, wasting a physician's time. These are billable hours. these are patient hours where a physician or other health practitioner can spend that time doing what they're educated to do and what they want to do, which is take care of patients. So when the bureaucracy is removed from the system, we're going to have plenty of patient hours. And the other part of that is we are losing hospitals. In like 1965, there were like 7,500 hospitals in the country. And now there's just over 5,000. In California, we had like 400 and I don't know, 60 some hospitals 20 years ago. We've lost 100 hospitals. We also have facilities closing labor and delivery, closing emergency rooms. So if Calcare invests money in refurbishing hospitals, clinics, and medical facilities, in building hospitals, in investing money into making sure that there are enough places to get care. The system right now is the exact opposite. It's depriving people of care by creating healthcare deserts. And in California, our rural hospitals, 29% are at imminent risk of bankruptcy and closure. And the same is happening with Martin Luther King Hospital here in Los Angeles, because they serve primarily people on Medi-Cal. In addition, the clinics and such have closed. So rather than get primary care, maybe at a clinic, they're getting it in the emergency department of a big facility at Medi-Cal payment, which no hospital can survive on that. So the fact that Calcare will invest is really, really important. And that's an answer for people, that it doesn't going to do any good to have a piece of paper that says you have insurance if you don't have anywhere to go. And when you have to wait 6 months to see somebody.
Yeah. And what I tell people, but those reimbursement rates are so low. I have all the evidence, and hospitals will close down. And I say, why do hospitals close down? A, it's because they're not making enough income. That's going to go away. Or B, because the investors aren't making enough dividends. So, sorry, go invest in something else. I think, Tamisa, did you want to say something? Your hand's up.
Yes, thank you. I just wanted to add that people with chronic illnesses and disabilities, our minds still work. And a lot of people that I know in the rare disease community, they're working, and they would continue at their jobs if they could get the care that they need. And right now, oxygen is a big problem. So, getting a form of oxygen that would allow a person to stay away from home. Right now, it's home oxygen. If it were defined as services outside the home, people could be more productive, lead more productive lives, go to school, stay in their jobs longer. So physical care is important as care for mental illnesses. So that's all I wanted to say. Thank you
So much, Jerry, and I really appreciate your time. We need to wind up. So if you haven't donated yet or you're not sure, please do.
James, there's one other person with their hand up who hasn't spoken.
Bella, please speak.
I came in late because I was at another meeting. Thank you so much for this meeting, this session. Sorry, I missed everything really here, but it's very informative. I'm very happy. I made a small donation on your site when I registered, and that was good. Listen, can somebody put on the chat that film, the film that was mentioned earlier? If somebody can put the link on the chat so that I can look at that film and promote it, share it. Thank you very much.
Thank you,
Okay, of
Bella. James, I know we're winding up, so can I say something in that direction?
course you can.
Thank you. Besides, thank you everyone for coming. I don't know if Jackie can hear us, but if I see Jackie Hernandez is on and she is leading our, I'm gonna mess this up, Unidos por Salud de Justicia committee. So glad to have Jackie on here. And then I see the heart, Jackie. Did you want to say hi real quick?
Sure. Hi, everybody. I honestly sound so weird right now. So I'm like, because I have like this new treatment that, by the way, I've been able to afford because I finally have a job that gives me healthcare, which that's sad. But anyways, I'm really weird right now. But hi, everybody. I hope that everyone has been having a good night. Thank you so much for the information, everyone. It's really cool to see everybody together for a cause like this. So I really want to know that the coming weeks I'm going to be a little more active. I've been a little missing in action, but I'm coming back.
Thank you so much, Jackie. We really appreciate all your work. And I also just wanted to share, so our next general meeting, Maureen and I had a really great discussion about where we would break down pieces of the bill. And so if you've taken a look at the bill and there's a particular section you would like us to cover, it's going to be very bill specific, really diving in so that we can understand it and be able to refute opposition talking points. But if there is a section of the bill that you would like us to cover, please email us. info@hc4us.org. And then of course you can go to our website, hc4us.org, and you'll find our email link. So that's all I wanted to say in closing, and I will turn it back over to James.
Excuse me, is it better communications@healthcareforus.org?
It either is good.
Either works. Okay, thank you.
So once you've
Can
donated,
somebody put the link of the film on the chat?
Yeah.
Maureen, is it Bella, was it the Fix It film? Do you know, Maureen, which one
The
she's?
one that you mentioned that that is very educational.
That would be Fix It. Yeah.
Fix it.
Maureen will put that in the chat.
Yeah,
You got
I'll
that,
put it in.
Maureen?
I'll put it in right now.
Okay, thank you, Bella. Sorry about that. We'll get that.
Thank you.
Two final things before we really wind up.
And the bill number, the bill number.
Okay, it's AB 2200, another zero, Erica. Also, make sure you've signed up for our newsletter. It's one way for everyone to be in touch at the same time and everyone's on the same page. The next thing is about our meeting time. We had a really tough time trying to find a day. Everyone's just, so flat out during the week. I was wondering how people felt about a Saturday, kind of a bit after lunch, about 1. Is that less stressful, more stressful, convenient? A bit of a show of hands, but that's kind of what I'm planning.
James, why don't we, after we get a show of hands, but we'll figure out the date offline because there's so many things to consider. But yeah, show of hands is great. And then we'll figure that out and let people know through our email.
Well, without further ado, I thank you all so much for taking time out of your evening to be with us and onward. It's not a matter of if, it's basically when. The child will eat their vegetables. What more can I say? Thank you so much, and I'm closing the meeting at 8:45.
Thank you, James, so much for leading this meeting.
Thank you all.
Thank you, James.
Thanks everybody for being here. Next time we're going to really dive into the bill, so come with questions or come with answers or your favorite part.
You can find the link to the bill on our website and you can start reading it to be prepared.
That's HC4us.org is us. And everything is there.
It's in the chat.
Thank you, everyone. Good night.
Good night, everyone.
Okay, adios, bye-bye.
And stop recording.